Okay, what do we got? We got crooked back. It's a horrible syndrome. Now, basically some people get this, I'll call it a crooked back. And basically a crooked back is you'll see people walking, Matt's gonna demonstrate this later on, and we're gonna show them how to help it. But basically they'll be shifted this way, or they'll be shifted this way. They typically can't also stand up. So they're kind of side bent is the most prominent. And sometimes it's more subtle. They'll just feel like a little bit uneven. They'll be like, Tom, I feel like I'm just not quite standing, like my lower body is not matching my upper body. And they'll just be walking like this. In extreme cases, you'll see them and they'll literally be like this. And it's new. It's not like something you've had for years. I was training a barber years ago that had a fixed crooked back. This is different. This is a new crooked back. It can happen just reaching over into the passenger side, let's say in your car, all of a sudden your back shifts and goes out, and it's shifted in one direction, okay? But also with a crooked back is you'll notice they'll be a little bit forward like this, okay? And they can't quite straighten. When they try and straighten out, they'll try and lean back, it makes their pain worse, okay? One of the things I think is occurring here, so this is our lumbar spine, the lower area here, and this is where we think most of the, I can't curl this guy too much, but this is where a lot of the curvature they think is coming from, or lack of curvature. So what we have here is we have a normal back, we have the vertebral bodies, and then we'll have that triangular bone, the sacrum right here. This is our L5, S1 disc, okay? This is our L4, L5 disc. Okay, this is disc material in the center. We'll show another one up here. Okay. This is looking from a back view like this. This inner material, this is what they think is occurring. We don't know if this is absolutely occurring, but this is one of the theories is what's occurring in a lateral shift or so in this lost extension. Is the inner portion of this disc right here called the nucleus pulposus, and you've got these rings on the outside. So this is like a jelly donut right here. When people that have a crooked back, or I'll call a lateral shift, they actually have their shifted, let's say they're shifted this way, okay? Okay. This disc material, in this case, we're shifted this way, okay? We're shifted that way, so I'm standing like this, okay? They feel that the disc material in some cases might be coming out to the side, so it's blocking it, so the person can't quite get over. The disc material shifts towards this side. In some cases, it could be a form of a herniation or a bulge just on that side. And it may not necessarily occur at the L5 S1 disc or L4 L5 disc, but that's what they think is occurring. It's kind of shifting out. What often happens is the nerves that go down into your legs, which are not depicted here, they'll get pain because of this bulge. Sometimes there's swelling on that side, and they'll get pain on that side. So if your trunk is going this way, most times if this is going to help you out, your pain is on this side, okay? They'll have pain here, sometimes buttock pain, pain down the leg, okay? It's typically not on the side that your trunk, your upper body is towards. It's where your hips are going towards. If you're walking like this, your pain is on this side. If your pain happens to be on the opposite side, it's less likely that this exercise is going to help you, okay? So remember, trunk away from the painful side. So you're going to have pain on that side, okay? So we're going to show a couple things that maybe you can do to help yourself today if you're at home and this is bothering you, okay? So the first thing we're going to do is we're going to show Matt right here. He's going to try and do one against the wall. So we're going to have Matt stand with his hands kind of like this, Matt. Put your hand up here. Now we're going to pretend like Matt's hips are shifted this way, okay? Can we see that, Kathy? We can move Matt over. Yeah, we can move Matt over. Matt's mobile. There we go. Young guy. Okay. Thank goodness he actually doesn't have a shift. So if he had pain, this would be this is where the side they'd have pain radiating down. Okay. He's going to first start by just trying to sink his hip in. So we're going to keep Matt's elbow straight, and we're going to let him just try and sink in like this. And he may not be able to go as far as he wants. He's going to say, that hurts a little bit. Okay. Then we're going to have you shift off. And we're going to slowly pressure on, right to the point where he can't move anymore. Pressure off. He's going to do that a few times. He's going, okay, Tom, not bad, but I'm still kind of feel that obstruction. Sometimes he'll start going further, but can't get past a certain point. So then we'll have Matt do is place his hands on his hips. And we want to apply force directly across, okay? So we're going to apply pressure, like that. Pressure on, pressure off, okay? Pressure on, pressure off. If Matt's saying, this is still bothering me, one of the variations we can do is sometimes I'll have Matt flex forward a little bit. I didn't explain it, right about there. Sometimes he has to start a little bit of forward position because he's so tight he can't stand up tall. We have to flex him. We start doing this side glide, shift over. It starts getting better. Okay, Matt, let's try and see if you can stand a little taller. Not bad. Okay, so now we're going to come over. All the way over and back. All the way over and back. So let's see, what does this look like if you're looking at it from a straight view? So we're going to come across like this. Matt, let's move you over. Let's pretend like we have a wall right over here. We're going to move here. So as he's applying pressure, he wants to continue to apply pressure. He's getting to the point where he's straight now. But what you want to do to make this really work, you want to overcorrect. So to pretend the wall's still there, he can apply pressure all the way across until he can cross midline, okay? So this is where he started. This is how he was. He's walked into my clinic like this. His hip is shifted this way, trunk is this way. His pain is down here on this leg. Let's pretend it's from his knee up to here, maybe the back, more like a sciatica type thing. He keeps on doing that shift. In fact, you actually don't need a wall. You know, Matt can do this by just, I'm going to step in front of Matt. Sorry, Matt. We're going to shift over, and he can do this without even putting his hand against the wall. That version is a little bit better, but I want to make sure you can see it from a front view. So let's try that again, Matt. Let's pretend we got a wall over there. So we want to slowly apply pressure until the point where we get all the way across. Almost knocked Matty over here. Okay, good. Now we're going to have him stand up. Okay, wow, it looks like he's all right. He's now straight, okay? Now we want him to do is we want to see if he can arch back, so if he can lean back. Let's see if he regained that motion. What did we say? Sometimes they can't stand up when they have that shift. Now we're going to try that. So now we're going to, Matt, let's see if he can pretend, see if he can do, let's see if he can lean back. All right, pressure on, pressure off. He regained that, okay? That's good. If he can't lean backwards, then he may need to do more of that side one some more, okay? But remember, he's got to continue to do it a few more times, 10 times, and then he's going to try it again. Let's see if we can lean backwards. Can he lean backwards? Oh boy, yeah, that feels better now. That's good. But sometimes you have to do this particular one 10, 20, 30 times. So when is a time when you shouldn't do it? Okay, so Matt comes in. We're going to move you a little further over here. So he comes in, he's shifted over here. We first ask him, and this is what you have to make sure when you're at home. You want to make sure, where is your pain right now? Let's say Matt told me it was in the buttock and down the back of his leg, all right? He's all the way back in this area. That's the furthest it goes. Go, Matt, is that as far as it goes? It doesn't go any further than me, right? Mm-hmm. Right. Good. When he does this stretch, it should not feel worse. What does that mean? Okay, that means the pain should start moving up. So as he's doing this, he may have pain at the very end of the motion. He goes, wow, that hurts like heck. But when he comes up, he goes, huh, it actually feels a little better. Like it's actually moving up my leg. That's a good sign. If Matt starts doing this, he goes, hurts like heck when I'm in the stretch and I come out. Now, Tom, now it's below my knee. Now I have tingling or I have something below where we started. Bad sign. So just remember, we have to know where we start before, so we know where the pain acts and how it moves, okay? So it's really important to understand that. Okay, let's say Matt can't seem to figure this out. He can't do it himself. We'll do a stretch for him, and I'll actually manually, I'll try and kind of stretch it myself. So the way we do this is, Matt, let's have you come to the front over here. Okay, I'm going to move this back a little bit so you can see this. Okay, so I'm going to have Matt face you, and we're going to pretend he has that same shift, okay? We're going to have Matt widen his stance a little bit. Let's come back a little bit so we're more in the focus, okay? This is how I do it in the clinic here, okay? We're going to place his arm like so. I'm going to give Matt a hug, all right? I'm going to give Matt a hug. I'm going to place my shoulder here. I'm going to grab the side. Now, this is the side that I'm pointing to that has pain. I'm going to slowly shift and pull his body towards me. Pressure on, pressure off. Pressure on, just like he would do it on his own, slowly working into it. And just like we told you, we got to get all the way past midline. Once we get to that point, I'll then ask the patient, let's try and lean backwards, lean back. That hurts like heck. Okay, let's come back again. Let's do a few more of these. We're going to come all the way across. Okay? So that's a way of doing a manual correction. Some people need to do that. They need that help. Sometimes you can do what Matt did earlier and actually do it, correct it yourself. But even after Matt did it, or if I have to do it for him or he does it himself, we want to then try and re-see, can we get a little bit more extension? If that feels okay, and you say, wow, I'm moving better, I can stand up taller, you then want to follow this correction by leaning backwards, okay? In some cases, you have people that I do this to them, and they said, please stop hugging me, you're killing me. You know, you're making the pain worse. pain's going further down my leg. So what I'll do is, sometimes this is a weight-bearing position, so sometimes we can't tolerate, the patient just can't tolerate standing like that. We can move them forward and back. Like sometimes I told you we'll have the person lean forward and we'll do that side glide position like that. They still can't tolerate it. So what we'll do is, I'm going to show you on the table here. I'll have the patient come on and lie flat. So they're going to lie. So Matt's going to lie with his head up this way. Okay. And let's pretend he's got a shift. So he's going to be completely flat. Now, his upper body, he's shifted. So his upper body is going to be up like this. He's going to be literally in a slight curve, I guess. It's just like he was shifted like this, but now he's lying on the table, okay? So his hips are shifted. So I'll have someone lie in the position. I'll have them just relax their elbows, lie down flat. So you want them flat, because what's happening is most times with this shift, they can't stand up tall. So we want them, the table, to always have a couple pillows. Sometimes I'll even add like 3 or 4 pillows, so the back is very flat and they're in a slightly forward position. So then what I'll do is, I'll either help them slowly trying to shift their hips over, or I'll have them work over. So saying, Matt, let's kind of shift over, like even inch by inch, like that. And try and get their upper body to shift in line, so they're actually getting straighter on the table. And they'll say, okay, that hurts a little bit, and then the pain will drop down. Same rules apply. If he's having pain right in and down his leg, if it gets worse and it goes further below his knee, we're saying that the pain hasn't gone any further than his knee. If it stops his knee, but it's still, you can move him over and it's not getting worse, like even the intensity of pain isn't worse, that's good. And I'll slowly, over the course of sometimes 5 or 10 minutes, sometimes I'll give him a hot pack to relax the lower back. Say, okay, Matt, let's shift a little further over. I'll have him just try and inch a little over. Like, okay, let's pretend like he's feeling better with this. Same thing applies. I normally like to have people correct. So he was too much this way. On the table, I want to get him so he's a little bit almost the other way. You typically don't make things worse than crossing midline. It's actually important that you do that. So Matt, I'm going to have you move a little further over, and his hips are right about here. So right now, Matt is now used to be this way, but on the table, he's this way. So once we know he's feeling pretty good, I'll move him back to the center, and I'll say, okay, now I want you to prop up on your elbows. So let's prop up on your elbows. So now we're going to see if he can tolerate, this is the equivalent of standing up tall and arching a little bit and standing. We try and see if he can do that lying on the table. If he can tolerate lying on the table like that, that's a good sign. So we'll say, okay, how does that feel, Matt? It feels all right, it's not great. Okay, then come back down, go back down to flattening. Give him maybe a couple seconds. Now let's try and go back up again, but let's place our hands underneath our shoulders like this, and we're gonna push up. Yeah, he looks good, of course he's not in pain, he doesn't have a true back rung. That's great arching right there. Okay, we'll have him do it 10 times. I'm not gonna have Matt do that. Do it 10 times. So let's have it flatten out. And I'll bet you slowly, I'll have them come off the table. So let's have you press up, and then you're going to slide your legs off. So slide your legs off, and you're going to try and stand up. Okay, stand up nice and tall. Miracle, he's cured. Okay, so anyway, obviously he doesn't have a back problem. He's a healthy individual. Sometimes when they get off the table, they go right back into that shift. And you sometimes have to do this a few times before you say it's not going to work for you, before you call me up or call your doctor up. But try this a few times. First start with the version that Matt did against the wall with his hand up. And let's review that again. Let's make sure we remember here. So Matt shifted this way. His hand, this should be the painful side. The hips are towards the painful side. His trunk is towards the wall. So let's pretend we have a wall there. So what does Matt do? He's going to slowly try, and at first he can do it without his hand. He can just kind of side shift over. Not quite the floss, but almost. Okay. I got to get a flush reference in there. Okay. And then back like that. And then eventually, it feels pretty good, but he's not quite to the point where he's completely crossing midline. And then he's going to apply pressure directly across. So pressure on, pressure off. He's going to do it a series of 10 times. Remember, we want to go to the point where he overcorrects. And then if he feels good after 10, he's then going to try and arch and lean backwards. Okay? All right, great. So that's one of the corrections. That's one of the tricks. Lying on the table, sometimes you have to get in that position where you don't have weight through your body, and that actually makes it feel, it's easier to make the correction, because in theory, let me just get Pastor Mackie over there. So in theory, we're trying to we've got our full body weight, we have Matt's head and upper trunk is pushing through these segments, and they just can't quite move that disc material, if that's what's going on. We don't care. What we care is that his symptoms change and he feels better. When he's in the stretch, it's not uncommon. At the very end of the stretch, you feel worse. But as long as you go back to the starting point, it's better, it's okay. But sometimes with that full body weight, they really need to lie down and do a little bit of that side shift. This is harder to do. I'll be the first to say, as a therapist, it's harder for people to figure this out on their own. The standing version is the one that, if it's going to help you, is probably the one that you want to try on your own. But it's just trying to correct that shift, crooked back. Hopefully that helps you out, and you can correct it and feel a little better. If you do that and it stays corrected for 2 or 3 days, typically it won't come back as quickly. But you want to do, even when you feel good, you want to continue that stretch the way you did it. Even if you're nice and upright, do that 10 times, then 10 times of the arch, and then hopefully that'll start correcting it. Well, I hope that helps you out for crooked back. Any questions, place it in the comments. Like and subscribe and share with anyone you know. Okay? Have a great day.